So as we talk about interventional, I've talked a lot about TMS or transcranial magnetic stimulation. The other really important interventional arm that we presently provide across all of our markets, or will be soon anyway, is a treatment called Spravato. It's actually a tweaked version of a compound called ketamine. Ketamine's been out for a number of years as a general anesthetic agent. It's been used in the animal population for years for anesthesia. And some very smart researchers stumbled upon the fact that if you were to give ketamine to someone with depression, they get better. And by the way, they get better very quickly. Since then, there's been a development of what's called the S enantiomer, or a piece of ketamine, which is called S-ketamine, and that is Spravato. Spravato does very much the same stuff, works through a very similar pathway as ketamine. And again, important to note, it works very quickly. So as we think about interventions, the other important thing to note is not only do they tend to be dramatically more effective statistically, especially if you've tried and failed 2 medications, certainly by your 3rd and 4th and beyond, they also tend to work much more quickly than traditional services like therapy and medication. TMS itself tends to work within about 4 weeks, sometimes a little bit longer. We think about traditional medications needing 6 to 8 weeks or more. Ketamine and S-ketamine, or Spravato, works within hours. We truly can turn someone around, or we can truly create relief for someone with severe depression, PTSD, in hours. Some of the science would suggest literally within 4 hours, we can dramatically improve someone's mental health state and actually keep it there, and do that at similar rates to TMS, 65, 70+% effectiveness in individuals who, if I would have handed them a 3rd or 4th medication, would be 15, 10, 7% effective. So as we think about having a toolkit and not just a hammer and nail, we think about interventional as an array of services, notably TMS and Spravato, both of which are highly effective, both of which work much quicker than traditional treatments, and both of which we offer as part of our continuum of care and our standard of care across our Transformations Care Network.